to the honorable members of parliament, led by the chair of the caucus and the area MP, together with the women rep, the chair of NACADA, CEO and board members, the county governments represented, various government agencies, the Girl Guides, colleagues, ladies and gentlemen, good afternoon. Good afternoon once again. I like the energy in the Girl Guides. Now, this is a very important day, and it's important to also note that on the 26th of June every year, we sit to commemorate the day on the fight against drug abuse and illicit trafficking. Now, we are gathered here to stand in solidarity with other like-minded governments across the globe in pursuit of a shared vision of a world free of drug abuse and the trade in narcotics. It goes without saying that this force continues to prey on the most vulnerable segments of our population and infiltrating our communities to the core. The Honorable Ndikiri mentioned that the focus is on our children, and they are the most vulnerable in this day and age. The consequences are evident. We have broken families, we have shattered dreams, we've got lost productivity because we end up spending most valuable time on either on the trade or in consumption of illicit alcohol. Then we end up with cycles of dependency and self-destruction and straining our healthcare systems. Earlier on, I was having a conversation with the Honorable Pasaris, and we were just discussing on the role that the National Hospital Insurance Fund needs to take to support in the rehabilitation programs for those who are recovering from addiction. And this is against the other numerous health challenges that we continue to face every single day. We all know how this trade is undermining our national security, and to be precise, how it is not only feigning violent crimes, but also funds organized crime and terrorism. In the last 6 months that I've been in office, I have had the front seat in taking part in the fight against this adversary. My position in management of our country's national security has landed me on a path that demands regular interaction with data on the use of drugs and narcotics. Among the most notable documents I've gone through is the latest NACADA National Survey on the drug situation in the country. And it's actually mind-boggling, because looking at that data, you realize that 4.7 million Kenyans aged between 15 and 65 years are currently abusing at least one prescribed substance. At first, many of us may not see the gravity of this finding, but it stings differently when contextualized in plain figures. We're basically saying that 1 in every 6 Kenyans within this age bracket is abusing one drug or another. Unfortunately, this is our most productive age bracket. What does this mean for our country and the millions of young people who are waiting for an opportunity to live their dreams? These young men and women are looking up to us to hand them a safe, secure, and prosperous country. Can we afford to let them down, knowing that their future is at stake? Can we allow them to fall victim to the devastating impact of drugs and narcotics? Can we only play the role of silent spectators in this disturbing drama? As you may be aware, we have listed the illegal drug trade alongside illicit brews as one of the top 5 existential threats to our country's future. We have assembled a multi-agency team to spearhead a nationwide operation against the criminal networks and seal up all access gates to these trades on both the supply and demand fronts. And just to respond to one of our MPs, yes, there's been a challenge both at the national and county governments in terms of enforcement, but there is an ongoing active campaign that is calling upon all of us, not just the governments, but all the stakeholders, including the leaders, including the communities, our religious and faith-based institutions, so that we are able to address the challenges that comes with illicit drugs and substance abuse. We have those who are already affected, and the question is, how do we empathize? How do we support them? How do we take care of them? But then we must also deal decisively with those who are involved in the trade, who are actually making it difficult for us as a community to live decently and live a wholesome life. Ladies and gentlemen, besides these control mechanisms and penalization of benefactors of these trades, we are now reorienting our drug and alcohol policy towards treatment, rehabilitation, and support of those who are affected. To serve as an example, we have begun sowing seeds of change from within, and our focus is on our security officers. Many of us may not be aware that some of our security officers are direct victims of drugs and alcohol abuse. These brave men and women confront harrowing situations. Some of them come face to face with life-threatening risks. Some of them have had to contend with trauma, prolonged exposure to high-stress environments, and yet we expect them to bear the weight of our national security without failure. This is where work-related stress creeps in. It is with a heavy heart that we acknowledge this harsh reality. As part of our ongoing security sector reforms, we have prioritized improvement of our officers' welfare and more access to mental health support. We acknowledge the comprehensive support system put in place by NACADA and other stakeholders, but it is also our intention to escalate counseling services and stress management programs to avert the destructive path of substance abuse. On this note, I want to applaud the theme of this year's International Day Against Drug Abuse and Illicit Trafficking. We have been called to stop stigma and discrimination and strengthen prevention. Apart from the reforms, the ministry is progressively fostering a culture of open dialogue amongst our officers. We are telling them, if you are an alcoholic and a drug addict, then you are of no use in our country's security sector as an officer. But not just that. There's a program that then we are working on towards rehabilitation, and also for those who are rehabilitated to be the ambassadors towards ensuring that we address the challenge that comes with drug abuse. Ladies and gentlemen, as I come towards the end of my remarks, I want to give the commitment of the Ministry of Interior and National Administration that we will continue to support NACADA to address the challenges around the resources and to put in place a conducive legal and regulatory framework to support the campaign for the nation free from drug and substance abuse. And very soon, we will be calling on the parliamentarians to support us in tightening the regulations around this space so that we end up with a society that we all aspire to have. We have recently had these engagements and campaigns in Central Region. We've gone to the Rift Valley region. Most recently, we were in Eastern. Next, we will be at the coast, and then Western region before we go to Northeastern. And this just goes to demonstrate the seriousness with which the administration of President Ruto is taking to ensure that we have a society that is progressive, a society that is not just turning a blind eye on the effects of what some of the individuals who partake in the trade of illicit booze and drugs and substances who are involved in trafficking expose our society to, but also for those who are directly affected. And I'm sure each and every one of us seated here is affected in one way or another. Either you have a brother, you have a sister, you have a mother, you have a husband, you have a son, you have a daughter who is thoroughly been taken down by the effects of drug and substance abuse. I want to commend the work that is being done by our partners, particularly within the civil society, and also the UN ODC in trying to help make this society a greater society. I want to thank you again in a special way, and I look forward to us continuing to engage for the betterment of this generation and the next generation. Thank you.
Principal Secretary, Ministry of Interior and National Administration, Dr. Raymond Namolo, members of Parliament present, members of the national government, representatives of county governments and other partner agencies, representatives of civil society organizations, distinguished guests, ladies and gentlemen, it gives me great pleasure to join you and the entire world in commemorating this year's International Day Against Drug Abuse and Illicit Trafficking, IDADA. On behalf of the Board of Directors, management, and staff of NACADA, I welcome you all to this commemoration and thank you most sincerely for honoring our invitation. My sincere appreciation to our chief guests, our peers, Ministry of Interior and National Administration, for finding time from your busy schedule to grace this occasion. Sir, we are pleased to host you, as your presence today is a clear demonstration of the government's commitment and leadership in the fight against drug abuse and illicit trafficking. As you are aware, June 26th is a significant date in NACADA's calendar. The day provides an opportunity for us to take stock of the gains realized, outline challenges encountered, and collectively chart a way forward in the fight against drug abuse and illicit trafficking. My heartfelt gratitude to all stakeholders at national and international level who have continued to work with us in the realization of the authority's vision, a society that is free from drug abuse. Ladies and gentlemen, each year the international body mandated to coordinate the global response to the challenge of drug abuse gives us a theme that dominates the IDADA commemorations globally. As has been said earlier, UNODC this year came up with the theme, People First, Stop Stigma and Discrimination, Strengthen Prevention, as it emphasizes the need to stop all forms of stigma and stigmatizing attitude towards people who use drugs, their families, and caregivers. The theme also calls on the need to strengthen prevention programs that are key in addressing alcohol and drug abuse, particularly amongst the young people. In addition, the theme advocates for enhanced public education on drug use disorders, available treatments, and the importance of early intervention support. As you will note, the theme is keen on ensuring that people who use drugs are handled with care while respecting their dignity, as this is the only way they can be reintegrated back to the community. In response to the growing challenge of alcohol and drug abuse in the country, NACADA, as the lead agency, has instituted a multi-sectoral approach that ensures the participation of all stakeholders. These are partners drawn from the public sector, faith-based organizations, and civil society organizations. This approach is in cognizance of the fact that the challenge of alcohol and drug abuse cannot be handled by one single agency owing to its multifaceted features and complexities that cut across all sectors. This coordinative role is enshrined in our mandate that is derived from the National Authority for Campaign Against Alcohol and Drug Abuse Act of 2012 and the Alcoholic Drinks Control Act of 2010. We also leverage on the legislation of other government ministries, departments, and agencies who are represented in the board to effectively respond to the complexity of alcohol and drug abuse in the country. To respond to our chair from the parliamentary caucus, actually our board is very well constituted. We do have the PS Health is a member of our board, the PS Interior, we have the PS Education is a member of the board. They send the alternates, and we are very grateful. We have the PS Youth Affairs is a member of the board, so we have most of the government most of the government departments are represented that deal with this issue. Through these concerted efforts, much has been achieved, and we take pride in the programs we have implemented related to prevention, treatment and rehabilitation, and compliance to prevailing laws and regulations. We therefore appreciate the contribution of all partners, including those who have provided us with resources and those that are solely implementing evidence-based programs in their communities. In so doing, advancing the country's aspiration in regard to drug abuse and illicit trafficking. We are particularly appreciative of the support we continue to receive from our parent ministry. Through the intervention of the ministry this year, our budget has been enhanced a little bit, and we continue praying for more enhancement. In addition, multi-agency collaboration, both at national and county level, and engagement with local leaders and communities has been strengthened. We also have received enormous support from the ministry in operationalization of the Mpeketoni Drug Rehabilitation Center. This is a project that is currently providing rehabilitation services to over 500 youths, and many have been reformed and successfully reintegrated back to their families and communities. As I close, allow me once again to thank all our partners and stakeholders for their support and efforts in the campaign against alcohol and drug abuse. Much appreciation to the public agencies facilitating the wellness programs, private agencies, as well as civil society organizations that are putting much effort in mitigating the problem of alcohol and drug abuse in their jurisdictions. Special appreciation to His Excellency the President and the Deputy President who have taken a stand against the drug abuse and are leading from the front. We also appreciate partners who have in one way or another have supported this commemoration, including the United Nations Office on Drugs and Crime. While we have received support from partners, it's never enough. The drug problem, both at the national and global level, is complex, hence the need for more vibrant and all-inclusive campaign. I therefore call for all collaborations, engagements, and partnerships at all levels. I invite all like-minded persons and organizations to partner with us in reaching out to all in the society. Together, we will make a difference. Thank you very much. With this, I would like now